Okay, everybody, it is 11:30 and I think we are all set to go. So I want to welcome everybody today to our Lunch and Learn on parent engagement and early intervention. Today is our first Lunch and Learn of 2026 and it's also our first time using WebEx. So please be patient with us as we work through this process. For continued compliance with ADA accessibility guidelines, I want to remind you about the closed captioning feature that can be used if you wish. Turn on the closed captioning during a WebEx webinar. Click the down arrow next to the CC bubble at the bottom left corner of your screen to choose your language. And then to turn on the closed captioning, you will click the CC bubble itself and it should turn white. And that means that your closed captioning is on and you should see the words across the bottom of the screen. If you are on your phone, you will click the three dots next to the red X at the bottom of your phone screen, and the closed captioning setup will be in your options section of that menu. I will also post these instructions in a few minutes in the chat. If you have any questions, you can reach out to me, and my email will be in the chat as well. Speaking of the chat, we ask today that you only utilize the chat to answer questions from the presenter or to ask questions directly to the presenter or myself. Please do not use the chat to make extra comments or reply to each other. I will put Jessica's email in the chat also. And remember that the recording of today's Lunch and Learn will be found on the TEIS website in the TEIS Community Resources section, and I will put the link to the website in the chat as well. And we're excited to have Jessica Beaver with us today from the Therapy and Learning Center. And so I'm going to go ahead and hand it over to Jessica to get started.
Okay, can everybody hear me? Dawn, shake your head yes.
Yes, yes.
And you can see my screen, correct?
Yes.
Okay, all right. Thank you for everybody joining today. I think most people know who I am, but for those of you that don't, my name is Jessica Beaver. I'm the program manager for the Therapy and Learning Center. Our agency is a vendor for speech PT and OT. We have a on-site clinic that provides those services to about 1,500 children a week across the West Tennessee region. We also are an ERA that provides direct services in Southwest Tennessee, and then we are currently an EEA doing eligibility evaluations for all of West Tennessee plus 3 counties in Middle Tennessee. To give you a little bit about my background, I have been in some form of early intervention for 20 plus years. I graduated a long time ago. I will be joining the 50 club this year, so that kind of tells my age. But not only in early intervention, I can honestly say that my understanding of true parent engagement became evident to me right after I graduated from college, and I took a job in abuse and neglect social work as I awaited a position in early intervention. But because one wasn't available at the time, I started my tenure in early intervention with Will Bonner, Early Intervention and Development in Memphis. Jill Rogers was one of my sidekicks back then, before I transitioned to the Therapy and Learning Center, where I've been for about 20 years. But like I said, I really learned the importance of parent engagement when I walked in a home trying to tell somebody what to do in parenting from a curriculum when I wasn't a parent myself. And it really helped me understand people. And so this is a topic that is I'm very passionate about, because I feel like they are the drivers in everything that we do. So with that said, we're going to get started. If I make sure this works, get my, okay. So please note, first and foremost, I'm going to use the word parent most of the time throughout this session, but I want everybody to understand that the word parent could be caregiver or anyone that's related to the care of the child being served. I just use parent to just be consistent throughout the training, but again, that can be a grandmother, a foster parent, it could be a friend of the family, it could be child care, it could be anything. So it's anybody caring for the child. But what we're going to do is we want to understand what parent engagement is, what it looks like, why it matters. And I know that seems like a simple question to most, but we're going to dive into it pretty deep. We're going to understand key components in regards to parent engagement, strategies to help promote it, not only in a session, but outside of that. Obviously, we know there's barriers, right? That's what sometimes makes it so hard. We love the places that we go and everybody's naturally and engaged in there. And then there's those that were like, I don't know what else to do. And so we're going to dive into that. And we're going to talk about what the outcomes of strong parent engagement lead to. So we're going to be cautious utilizing the chat because we want to make sure that we can translate everything. However, I do want some back and forth exchange, and Dawn and Leanne and the team are going to help me monitor that. But if 3 or 4 of you would be willing to put in the chat your definition of parent engagement, what that means to you.
Alicia says involvement. Jonathan says listening. Emily says being an active participant in therapy intervention with their child. Danny says working together. Casey says the parent is genuinely interested in what is happening in the conversation. Scotty says follow through with recommended strategies. And Shelly says gaining rapport.
Yes.
Rapport. I think that's rapport.
Thank you. And I love all of those responses because we know that the parent being present and participating is so important, right? So with the show of hands, tell me, raise your hand. I think there's a little button at the bottom that will allow you to raise your hand up or down and put if you feel that engaging parents is easy or do you find it difficult. This is often a talking point in some of the staff meetings here at our agency, especially with those of us that have done this a long time and the difference of how some families look and priorities of parents. But do you find this something that's easy and natural for you, or do you find it difficult? So if it's easy, put your hand up. If it's not, do your hand down.
I saw several thumbs up come across the screen. So, and I also wanted to add that Nina said building a community relationship with the parents, and Marissa said communicating with all team members. Michelle said interacting with the child and the worker during their interaction, engaging in conversation, and being involved to take action. Most everybody was doing thumbs up. We had 1 or 2 thumbs down.
Okay. Yeah, and I think most of us do probably feel pretty confident, especially with the FGRBI model. I think that has led to a lot more parent engagement. But we're going to dive deeper into it and see if you feel as confident or sure at the end, not to make you not feel confident, but hopefully everybody gains something from today. So FGRBI, like many of you says is a collaborative partnership. Okay. It's where EI providers go in, we're going to coach caregivers to embed learning opportunities for their children within their existing meaningful daily routines and activities. To me, there's two key words in this definition, and that's collaborative partnership. It's important as we work with parents and as we begin to guide in engagement that we understand that just their presence or their participation doesn't necessarily mean that they're engaged. Okay. We want to make sure that that is very collaborative and that it is a true partnership. Back in my early days of when I was doing developmental therapy, I remember one of my trainers said to me, if when you leave that house at the end of that 3 years or that 1 year or 6 months, however long you're there, if a parent is able to say, because of this person, I am confident in what I can do, instead of, oh my goodness, your time's up. What am I going to do now without you? Will help measure how effective you were in empowering that parent. And so that leads us into, why is it important? If 3 or 4 people could put in there why we think parent engagement is so important, outside of the fact that it's a natural component of FGRBI. But why is it important?
Hallie says we won't always be there. Michelle says helps generalize skills learned. Julie says leads to better outcomes for children. Cindy says increase family capacity. Christine says people learn by doing.
Yes, I love all of those. And that very first one, we are not always going to be there. And that child doesn't stop growing. Those challenges might continue. Or even if it's something that's long term, it might not, it's that we're not there tomorrow, right? We're there for an hour a week, maybe, even less, and sometimes only 2 times a month. And so we want to make sure that when we're not there, that they know what to do. So we know that parent engagement will naturally improve child outcomes. It leads to family empowerment, sustainability, and stronger relationships. All of those are items that you put in the chat. And this is why it matters. We want to make sure that they can sustain what we teach them together, what we partner with, that they feel empowered to be able to lead and do things with and without us, because we're not always going to be there. And ultimately, our goal is to increase the outcome of the child, right? And then it builds stronger relationships. And I can honestly say, I think about the relationship piece all the way back in those early years and go, man, if I would have only known what I know now, how much I could have made a difference in some of those earlier families. Obviously left them with some good nuggets, but didn't, I wish I could go back and kind of hit redo. But I shared that I did abuse and neglect social work prior to this job. And I will never forget, I share this story often, about the person that probably taught me the most about understanding, engaging that person into the session that you're working on. And so if you don't mind, I'm going to share it for just a minute, but her name was Marietta. I'm not going to say her full name for her privacy, but she does know I share this story often. But I was doing parenting for first-time moms. Most of them were teenagers. A lot of times it was court appointed. So many of them were having to do it because the judge said so, or other people were having to do it because of guided relationships within maybe the grandmother that was caring for the grandchild and the great grandchild, things like that. So oftentimes I was not welcomed or received. I was 22 years old, straight out of college. Um, showed up with my handy dandy curriculum that was going to outline everything I had to say. And lo and behold, in Grand Junction, Tennessee, that took me an hour and 10 minutes just to get to her house. I'd pull up on this house and sitting on the porch would be Marietta. And I would always go, "Hey, how are you?" And she would just nod her head. And I would try to build those setting the stage questions like we do in FGRBI right now, like, how's it going? Did you have a good day? Do you have any updates? And it was always like, fine, yes, no. Is there something you want to talk about today? Nope. And I would go back to my boss and I'd say, I don't know what to do. I can't get her to talk to me. And she would like, try this. And we would go back and forth. And even to the point that one day my supervisor said, tell her, say, you don't want to be here. I have to be here. Let's make the best of it. Tried that. That didn't work. And one day I stopped at the Dollar General store to use the bathroom. We've all done that, right? And I was just like, God, I don't know. I just want to reach her. She won't talk to me. This is the longest hour of my life. What do I do? And as I was walking out, it's like it was sitting right there, and it was hot Cheetos and a grape soda. And every time I showed up at her house, she was always eating a bag of hot Cheetos and drinking a grape soda. And I was like, you know what? I'm going to get her some chips and a grape soda, and I'm going to take it to her. So I pulled up, walked up, and I said, hey, how are you? Got the same nod. How was your day? Fine. And I said, oh, by the way, I stopped at the Dollar General to use the restroom, and I picked this up for you. And I handed her the hot Cheetos and the grape soda. And she said, how did you know? That's my favorite. And I said, well, I mean, you're eating it every time I come. And at that moment, she started talking to me. And I realized on my drive home that day that the reason she started talking to me was not because I brought her a snack, but she finally realized I saw her, that I noticed her, and that instead of coming in and talking, I realized that she realized that I saw something that signified her. And so I realized that it's so important to establish that relationship and build that so that we can transition into what the components are and so are so important. So obviously for strong parent engagement, we've got to have shared responsibilities. FGRBI talks about that. It's supposed to be a back and forth exchange, but that's not something that we can just naturally dive into and start from the beginning. It's the process is a partnership. We want to make sure that we focus on everyday routines, right? Interventions are not separate therapy sessions. If somebody walked into my house once a week and told me I had to add something to my plate, I would probably throw them out right then or not want them to come. Not because I didn't like them as a person or I didn't enjoy them, but most of our families are in survival mode constantly, whether it's that stay-at-home mom, whether it's that full-time worker, whether it's the fact that there's multiple siblings in the house, or we're trying to figure out how to pay the bills, cook dinner, do those kind of things. And our role in that is to build capacity. And I think somebody said that all the way back in the beginning. And it's to coach. And that's so important, especially with FGRBI. And we were just recently in an Iterator reliability training that Leanne and them had with us over the Snowmageddon that I like to say hit our state. And Julianne Woods was talking about how this capacity building and our role of coaching is so essential. And it's also one of the reasons that they made some enhancements to the FGRBI model, is to really put an emphasis and focus on that capacity building. We want to make sure that the family priorities are present. The intervention should be relevant and meaningful. It kind of goes back to Marietta. Like, I had to make sure that I saw her as relevant. It wasn't me coming in and just telling her. It was at that point getting to know her. And the curriculum that I was trying to do, she didn't care anything about. At the end of the day, it was what she felt. And the second we started building that relationship over some hot Cheetos and a great soda, I learned what her priorities are. And then she was an active participant after that. And that two-way communication. Yes, no, those closed-ended questions doesn't give us that two-way back and forth exchanges. And if we don't have that, obviously we can't do active parent engagement. So how do you start? Where do you start? We talk about in FGRBI, setting the stage is so crucial, right? It's what sets the stage for our session each time we come. But in order to set the stage of the service, we've got to begin by explaining our roles. FGRBI has a wonderful handout that for those of you that need that, sometimes it helps that families see it in writing, that it's not just something you're asking them to do. It is what it actually what we hoped for them to gain. It's not my opinion. It's backed by research-based practices. And then some people need to read over it because after we talk so much in that initial stages, the service coordinator comes in, is trying to explain TIS and IFSPs and TCMs and P's, like everything, DT, EI, all this alphabet soup, right? That we put this in our intake packet here at our agency because we want them to be able to go back and read it. And I know some people say they never read that stuff. But it does give you a point of reference. It gives something you can refer back to for clarity. But it's a good way to guide those conversations, especially some of you that may not be certain of how to promote that. The other thing that we do here at TLC is we still utilize the AEPS family report. I will swear by this. Sometimes my staff are like, some of these questions don't pertain to these families, and they don't, and it's okay to mark NA. But I think it's a great way, and I think if any of them are on here, they might could chime in into the chat and Dawn could read it. But it starts that back and forth exchange. It gets the family comfortable with asking questions. We always tell them if there's something we ask that they don't know the answer to or they don't feel comfortable asking, answering, they don't have to. This is not something that we leave with them to fill out and then hand back to us. It is something that we go through back and forth with conversation. It's an easy way to get them to talking about their priorities, because I know all of that is in TEADS and in the beginning, but it's sometimes you don't realize what their true priorities are till you start asking some of these questions. And like I said, the family report makes it easy. It again starts talking about what their routines look like, what the days look like, what their long-term goals, because I know it talks about how do you want your child to be in the community. It helps us know who their support team is. And it's just a great way to get started. We do this in our first or second session, most of the time the second, because we do face-to-face intake. It's not done through DocuSign or anything like that, because we want to be able to talk about and be able to answer questions, and we don't want them scrolling through a big intake packet and just hit sign, 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 next, next, next. We want to make sure that they understand. So this is typically within our second session that we're going over this. So I encourage you to use it if you're looking for a questionnaire, because it does talk about the primary routines, what the family wants, what's working well, what's not. Again, some of it is not always going to be appropriate for every child. That infant, that preemie infant might not have some of those. And then, I mean, we know we can read the room, right? We know which ones that we might not want to ask out loud. But it's a great tool. So anyway, that's something we do. And then, of course, the whole purpose for parent engagement is that empowerment. When we were on that training with Julianne Woods, and she was talking about the enhancements made to FGRBI, this was a key component of something that she talked about quite a bit. Of course, we had multiple questions about specific indicators, the wordings, why they changed, and she explained that. But they talked about that when they went back to pull research about the effectiveness of FGRBI and trying to gain some data and understanding on that, while also reviewing multiple sessions of people that were implementing the model. They noticed that a lot of coaching was primarily direct teaching. And we know that that's a coaching model on FGRBI. However, within direct teaching, we're doing all of the work. And we might be doing it, but if we don't follow up with that opportunity to practice and things like that, are we truly empowering them? And did we pull them in on that strategy? And that was one of the things they talked about, is people were good with saying, oh, let me show you how to do this and direct teach. And then when it came time to integrate into the strategies into the routine, it was like, and you can do this at this time, and this time. And they weren't pulling in that parent and doing that empowerment. And that's one thing that they really put an emphasis on and talked about, because it goes back to what we were talking about earlier. What's your definition of engagement? Present and participating doesn't necessarily mean engaged. In the beginning, Marietta was present and she was, I guess, participating. She was answering my questions, but she wasn't fully engaged until we established that connection. We also know in conscious discipline, right? Connections on the outside build connections on the inside. And so we want to do that because our ultimate goal is to empower that parent and build caregiver capacity, right? And we want to do it within the strategies, integrate the strategies within the routines of the family, because we want them to tell us when can they do this and help them and pull them in. We should never say, hey, you can do this at this time, and this time. It should be, when do you think this is something that you could do? It happens in that reflection part. Is this something you like? And a lot of times we are going to ask, is this something that you think you can do? And we know this because they've practiced it and they can tell us if they feel confident in doing after we coached them, whether it's with guided practice or direct teaching. But I would encourage you, just in this segment, to ask yourself, if you had to reflect on which coaching strategy you use the most, is it one that allows you to constantly still come in and be the expert that we can attach a title to? Or is it one that's truly empowering the parent based on their needs and what helps build that confidence within them? I often tell my staff, if I come and spend the whole day with you and you see 5 families, I hope I don't see the same coaching technique with all 5, because all 5 of our families are different. We want to make sure that we're meeting them where they're at, which leads to the, okay, my slides are out of order. Which leads to making sure that we provide clear and specific feedback. praise versus feedback. I often think of Amy Jenkins in this. When she would train a lot, she would always say, if I hear one more person say, "Good job," she said I might scream. So in the chat, if somebody could give me an example of a simple feedback that you use outside of good job, and I know everybody does good job, I still do it, but Amy used to tell us good job is praise, but it doesn't give feedback. Good job at what was your good job? What did you do good? And who's doing the good job? Is it that the kid took the step? Is it the that the parent did something? Or so how do you know what good job is?
Okay, first I wanted to let you know that Danny said she loved your story about Marietta. Ashley said, I like the way you did blank. Felicia said, I like the way you also. Elizabeth said, I love how you did that, being specific on what they did.
Okay. Yes. And so you're pointing out what they did. And then the next layer of that, that strengths-based feedback is oftentimes I like to try to say, I love how you did XYZ. And because of that, your child did XYZ. I think Regina, it just popped up. I saw that. Um, I think that's what Regina just said.
Yeah, we've also got Jennifer said, I like the way you, how do you feel about it? Julie said that was great. In the future, you could add dot dot dot. Christine said, "Look at you! You put your toys away." Regina said, "When you did blank, your child did blank."
Yes.
Kaylin said, "You are doing a great job with XYZ, or you and child, and making a lot of progress with XYZ."
Yes. And the reason we want to do strengths based is because obviously when we're in the house, most of the time the parent wants to do what we recommend or what we come up with as in a joint interaction in developing a strategy. Because they have us there because they want our help. They want us supporting them. They want us walking with them, which is often what I tell my families when I'm doing intake is, yes, I'm here to help, but most importantly, I'm here to walk with you. I'm going to celebrate the good. We're going to figure out the struggles and the hard, and I'm going to hold you when you cry, like whatever. I'm walking with you. Um, but that strengths base, every time we do it, it gives them that empowerment, that sense of confidence. And then that way they feel comfortable doing it when we leave. We all know, we say it all the time. How many times do you hear say intervention takes place in between our current session and the next one? So if we don't give them specific guided directed feedback on what they did and that it's clear outside of just praise, then it doesn't build that confidence and competence, but also we want them to be able to recognize what did I do that helped make this progress? Because if we come back and the strategy's not working, or maybe it worked one or two times, but it didn't work the other 10, we want them to be able to reflect, right? On, okay, is there something that you did different or was done different within the routine or the function of the day, whichever, that possibly led to it working these 2 times versus it not these 8 times. And so if they don't start understanding their role in it, the environment's role, the routine, whichever, they're not going to be able to do that self-reflection. And then when we come back and go, okay, how did it go? What we agreed to work on this past time, how is that going? They're going to say, well, it didn't really work. Okay, why did it not work? They might not be able to tell us. And then we're back at grasping straws trying to figure out what to build on next, how to guide them, even what questions to ask. And so that specific feedback is so important, not just for empowerment and confidence, but also for reflection and review, for them to be able to come back and tell us, hey, I think when I do this, it's working. Sometimes so we might could grab this piece of it, but when I was doing this, it wasn't working. And so I think we need to polish this or come up with that. And so that back and forth exchange.
Uh,
Yes.
Jessica, one more comment. Kawani said the way you did blank was a really great choice.
Yes. Love that. So then you're even empowering her in what she chose, or him in what she chose. So with parent engagement, we have to be flexible. What don't you wish you could do what that girl's doing in the picture? What does flexible mean in parent engagement?
Stephanie said meeting them where they are. Salome said follow the parent's lead. Haley said understanding what is possible right now. Kawani said being able to adjust to what the caregiver's needs are. Casey said being able to adapt to the family's need. Elizabeth said go with the flow. Taylor said being prepared for any answer, whether about the child or the parent's life.
Yes. Taylor, I love that. Be prepared for any answer. FGRBI refers to flexible as the approach, adaptability, and responsiveness to each family's unique needs, priorities, and daily life. Most of you said that. Like, we have to be prepared for what their answer could be. We need to understand that every family is different, their priorities are different. We also need to understand that we might get there one day and the family needs us to be there for them, and it's not even about the child. We could show up and it's a crisis. We could show up and something just happened and that parent needs that. We all know that if I'm stressed and I didn't sleep the night before, some of our staff presented at our staff meeting last week on stay-at-home moms, and sometimes the things that we don't often think about that lead them to be in different places each time we go. You know, if we didn't have sleep, can we focus and think and be an active participant and engaged in that session when I'm utterly and completely exhausted? Am I trying to multitask so many things that I can't focus? And so how do we help them hit pause? But we have to go in and be flexible. Again, just like what I said earlier, if I go with a staff member and spend the day and we do 5 sessions, are they using the same exact strategy for every single family? Are they using the same coaching model for every family? Are they asking these same exact questions with every family? If that's the case, we're not flexible, right? We go in with what we think and what we do, and most of the time, probably what we feel comfortable with. But we want to make sure that we're flexible to the family, understanding where they're at, what they need, what they're comfortable participating in. Julianne Wood stressed this a lot. Somebody asked the question, when do you think a staff member is fully vetted and ready to provide FGRBI with fidelity? And it wasn't in 2 months. It was an extended period of time. And that goes back to our families too. We're going to have some families that we can dive in and they're very comfortable and able to participate in that back and forth exchange, being honest and being comfortable looking, going, I'm not going to do that. I mean, I'm sure every one of you have had families that say that. You are going back and forth. Well, what do you think about this? And they say this, and they're like, and that back and forth, and you mention a strategy and they're like, no, that's not, I will never do that. I'm not going to do that. And we have to go, oh, okay, and keep going. And now we might dive a little more in that. Tell me why. But we have to go back and forth for that family-led decision making, adaptable implementation, recognizing that everybody's routines are not the same. I've potty trained a child sitting with no clothes on a potty seat at her play table because the child had profound autism and that's where she wanted to sit all day. And the second they tried to go into the bathroom, it was a panic attack. And so why would we try to potty train in the bathroom, right? So adaptable implementation, dynamic and responsive. There's times we've got to go in and we've got to be responsive to what that family needs right at that very second, instead of diving into the functions of the session. Provider adaptability. Do they need our help at Tuesday at 10 o'clock, or do we need to be flexible and move it to Thursday at 1 to be able to meet the routine that's causing them the biggest stress at that time? Is it going to a dentist appointment? Is it adjusting where your session takes place? If, a family looks at you and says, I just wish we could go out to eat as a family. Okay, how can we make that happen? Or are we going to just try to talk about it? Or can we meet them at a restaurant and figure out what's going on? And then focus on functional outcomes. There are certain things that are not important to some families. And even though we know they're best and we do want to talk about that, we are the experts in child development. But if you push so hard on something that you feel important that is not important to them, we're never going to have them engaged. That goes back to Marietta, right? I'm going with this curriculum of what we're supposed to talk about, and I might as well have been a version of Charlie Brown's teacher every time I went there because she was not listening to me, and it sounded like wah, wah, wah. Y'all have seen the cartoon. Because she didn't care. It was not important to her. And so we've got to make sure that it's important to them in order for them to be engaged in what we're doing. So be flexible. Barriers. We all have them. If you have a caseload of 20, you're going to have that one family that you're not sure what to do. And so throw in the chat 1 or 2 words, not long sentences, but what is something that makes engagement challenging?
Taylor said phones.
100%.
Julie said siblings. Ashley said TVs. Language barrier from Alyssa. Michelle said withdrawal from parents or withdrawal with parents. Haley said having to care for other siblings. Virginia said a parent who cancels visits continuously. Casey said denial that their child is delayed. Ronnie said loud music playing.
Yes, all of those things. There's times that, I know, when the snow hit and we were doing telehealth or things like that, it was just chaos a lot of times in the houses because, we also often talk about sometimes like, oh man, it's summer, they're getting out of school. That means all the siblings are going to be there. But guess what? When we leave and the day goes on and the parent is having to implement strategies often that we come up with, the siblings show up, right? The husband or the father or the, older brother or the other family members in the house get off work or things like that happen. And so Those are barriers to us, and I agree with them 100%. I'm not saying that we should just go, oh, they're not barriers, but those are important things. Like if it's a barrier to us, often it's a barrier to that parent or that caregiver. Um, Cultural and language differences, 100%. Like if they don't understand what we're saying, and we don't understand what they're saying, there's going to be a disconnect, right? Lack of confidence or knowledge, that's often some of those early families where we're asking that back and forth question and they can't answer it. And then we get into that direct teaching model, and sometimes they lean on that because it's easier. And it goes back to, okay, how can we set the stage and start that process to build that back and forth exchange? Time constraints and stress. Excuse me. So many parents are driven by this. We live such a fast pace. My sister has an adopted son from Guatemala, and when he first came to the States, he goes, "You Americans never slow down." And I was like, "What do you mean?" We were wanting to show him everything. He goes, "Do you not ever just sit?" And I never thought about that because we get so comfortable in our norms. And then feeling judged or misunderstood. That's an oftentimes barrier. I think about this one family one time. One of my staff members said, "Jessica, can you please come to a session with me? Like sometimes I'm having to drag mom back in the room. Every time I talk to her or say, hey, do you want to try this? No. Do you want to do this? No. Can we work on what do you want to work on today? Whatever you want to do." She was like, I can't get her to do anything and I don't know what else to do. And so I went and I mean, that staff member was hitting all those FGRBI indicators like the back of her hand, asking those questions, setting the stage, checking in on family members, all those kind of things. Um, and just like she said, that mom was like, no, no, no. Um, and then I noticed that in the update part, she was talking about when my child was at therapy, I even went and bought the same bubbles we used at the clinic. I bought the same blocks. I get her home. She doesn't want to do them. I can't get her to do it. And so as we reflected on it after the session, it wasn't that the mom didn't want to do it. It was that every time she tried to do whatever was recommended, she couldn't get the child to do it. And she wanted her child to progress so bad that she would rather step out of the picture versus failing and not getting to get her to do it. So if I stepped out and she'll do it for y'all, then she's going to get better. And so after we reflected on that, when we debriefed the session, I challenged her to, instead of going the next week saying, how's it going? How was therapy? How was speech? How was this strategy? All those kind of things, to go, what is your favorite thing to do with your daughter? And then when she finds out what that was, try to embed a strategy into that. And her favorite thing to do with her daughter was to push her on the swing. And so they implemented a strategy inside of her pushing her on the swing. And when she went back the session after that, the mom was like, oh my gosh, let me tell you what she did the other day on the swing. And so what we had viewed as a disengaged parent that didn't want to participate or do anything, it was really her way of trying to do what was best for her child. Because if her child would do it for us with the speech therapist, whoever, I would rather that happen. And so sometimes we've got to take that step back and realize that what we think is a barrier, we got to go back all the way to the beginning. We got to remember to meet them where they are, to dig questions, to discover the why. Because if it's a barrier for us, it's a barrier for them. Outcomes of positive engagement, we know we've said this multiple times as we start to wrap some of this up. It improves their caregiver confidence and empowerment. It reduces parental stress. you know, as parents, those of us that are at that stage in life, we love when we know what to do. If you want to see a person stressed, have them not know what to do. I think about when my daughter was trying to decide where to go to college, and I didn't have the answer for that. I didn't know what tomorrow looked like. Like, that was so stressful for us because I didn't know. But in the things that I'm confident in, I'm like, man, if your kid can't talk, give them to me. I got this, you know. So it reduces that stress when we feel confident. Better family functioning overall because we're making those routines easier. That family wants to go out to eat now because we empowered them and gave them the confidence to be able to manage that restaurant with that child. And then again, and most importantly, it's going to enhance that child developmental skill. They're going to start making that progress. The whole purpose of why we're there is to help them reach that. And then last, as I wrap this up real quick, um, another thing that we do at our center that is so important is we don't want to just build parent engagement with us as the worker. We want to build an opportunity for parents to be able to engage with others without breaking those HIPAA guidelines and all that kind of stuff. So we set up different things for our families. Probably one of my most favorites is something we implemented last year. It was called Let's Talk Behavior. And so we partnered with We Rock the Spectrum Gym here in our area, and we offered quarterly classes targeted on behavior because we know that's a big point right now. Um, and it was $6 for them to come, and that was just to get buy-in and ensure people showed up, because the first time we didn't charge, we had like 75 people register, and we had all this food for that many people, and then half of that showed up. So by paying it kind of put a little bit more buy-in. But our developmental therapy team provided childcare in the gym while our parents were in a classroom, learning about functions of behavior, conscious discipline. We started with our staff, then we brought in outside people. And then this year, our Let's Talk series is going to be on topics that those parents asked us. And so it might be Let's Talk Sleeping, Let's Talk Eating. But it's not just going to be a whole year focused on behavior. So that's an educational time, but also to let them understand that other parents are having some of the same struggles. And it ended up being a nice meet and greet, and parents formed new bonds, and kids were able to play. We have our Splash and Dash race. It's on Saturday. It's like a color run on steroids, but it's another great time that celebrates our center and all of our families, not just in our EI program, but within our clinic, our adult services, our horseback riding therapy. It just brings everybody together. We do that annually. And then we have many family days, and we try to do them throughout the normal regular time, not just at night and on weekends. And so sometimes it's just bringing the people that are together, our DTs, and offer the session to be changed to our location to participate if they want to, just to help establish and build that stronger community. And then we have an I Can Try triathlon, probably one of my most favorite events ever. And it's where we bring typical peers and our special needs population together to compete in a sporting event that is adapted to meet the needs of everybody participating. They actually do swim, bike, run, whatever that looks like. The bike could be a wheelchair, it could be a regular bike. But so many times there's events that are like special needs athletics, but we want them to be able to compete with typical kids too, instead of separated. And our I Can Try does that, and it's wonderful. So it's just another event that we offer. These are some of my superstars in the picture. And so those are just some quick things that we do here at our center, just to increase engagement and to build all of that, not just with ourselves, but with other families in the community. And that's all I got. And so FGRBI.com is a great resource. Obviously, the indicators manual. I love the Engaging Families handout if you've never read that. Also Sheldon and Rush, their coaching handbook, and then there's my name and number for anybody that needs it. So if anybody has questions, we'll take the next few minutes for that. If not, I'll let Dawn and Leanne wrap it up. And I hope I left you with a nugget today.
Yes, and I was going to say, if anyone wants to ask a question, you can put it in the chat and I will read it out and Jessica can answer it, or you can raise your hand and we, Leanne and I will try to unmute you so that you can ask that question live if you would like. So I'll just kind of pause for a minute to see if we have any questions. Elizabeth said, not a question, but such great info. And I agree, Jessica, we really appreciate you talking with us today. Hallie says, our county DTs do a community park day one time a monthly. We had 8 families come this week, and a big smiley face. I think that was a great thing. I did put in the chat our survey. Just remember that the form stack link for the survey is in the chat. Please be sure to complete the survey to receive your confirmation of attendance and to provide feedback. If you have any questions or issues regarding today's survey, you can contact me at my email. And then let's see, I think we had Kawani said everything was explained so well. Thank you so much. Casey said, thank you. These were such great reminders. Mary said, thank you. Lots of thank yous coming in for Jessica. Okay. So just remember that the recording for today will be on the community resource website. I put that in the chat it's up near the top. It'll take probably a week or so for that to actually show up on the website. So just be looking for that if you would like to see it. Again, the next Lunch and Learn will be Wednesday, May 27th, 2026 at 11:30 Central. Shannon will be with us. Shannon Pargin will be with us to provide some information on federal indicators. And Emily will be back with us then. She's at home with her beautiful new baby. I'll stick around for a few more minutes. If anybody has any more questions or anything, you can let me know. And just remember when you go to leave the webinar to click on the red X at the bottom, and then you'll have to also click again. It'll say like leave webinar or something like that. If you click the X at the top, it will just X out your screen, but it doesn't exit you from the meeting itself. So just remember that. And thank you so much, everyone.